USMLE style question. A 72-year-old man with a history of chronic alcohol use and mild cognitive impairment presents to the emergency department after a minor fall at home. He did not lose consciousness at the time, but has developed progressive confusion and headache over the past few weeks. On neurological examination, he has mild left-sided weakness and slowed mentation. A non-contrast CT scan of the head reveals a crescent-shaped hypodense collection that crosses suture lines, but is limited by the dural reflections, falx cerebri and tentorium. Which of the following is the most likely cause of this patient's condition? A. Rupture of bridging veins, rupture of the middle meningeal artery. C. Hypertensive intracerebral hemorrhage. D. Aneurysmal subarachnoid hemorrhage. E. Cerebral amyloid angiopathy. Answer and explanation. Correct answer, A. Rupture of bridging veins. This patient has a subdural hematoma, which results from the rupture of bridging veins. These veins traverse the subdural space and are particularly vulnerable in elderly patients with cerebral atrophy, where the brain shrinks and stretches these veins. Acute subdural hematoma occurs after high-energy trauma, e.g., motor vehicle accidents, shaken baby syndrome. Chronic subdural hematoma occurs after mild trauma, often in elderly patients or chronic alcoholics, due to slow venous bleeding. Symptoms develop gradually over weeks to months and may include headache, confusion, and focal neurological deficits. CT findings: crescent-shaped, concave, hypodense or mixed-density hematoma, crosses suture lines but is limited by dural reflections, e.g., falx cerebri. Incorrect answers: B. Rupture of the middle meningeal artery causes epidural hematoma, which has a biconvex, lens-shaped, hyperdense appearance and is associated with a lucid interval following trauma. C. Hypertensive intracerebral hemorrhage occurs in patients with long-standing hypertension and typically affects the basal ganglia, pons, or cerebellum, not the subdural space. D. Aneurysmal subarachnoid hemorrhage presents with sudden thunderclap headache, often due to rupture of a saccular aneurysm, e.g. at the circle of Willis. CT would show blood in the basal cisterns or sylvian fissures. E. Cerebral amyloid angiopathy causes recurrent lobar hemorrhages in elderly patients due to B-amyloid deposition in cortical blood vessels, but it does not present as a subdural hematoma. Key learning points: subdural hematoma, bridging vein rupture; acute, high-energy trauma, e.g. falls, shaken baby syndrome, MVC; chronic, mild trauma, cerebral atrophy, elderly alcoholics; symptoms: gradual onset of headache, confusion, focal deficits. CT scan: crescent-shaped concave hematoma, crosses suture lines but limited by dural reflections. Treatment: small hematomas may resolve, large hematomas require surgical evacuation. Would you like a question on another type of traumatic brain injury, such as diffuse